Hey everybody, Organized Biology here. We're going to be going through the NCLEX practice questions so you can pass the test. So number one, we have a patient admitted with a diagnosis of hyperparathyroidism. Which is the most likely finding? So we've got elevated serum calcium, low serum parathyroid hormone, elevated serum vitamin D, or low urine calcium. Which do you think is the right answer? Well, in order to answer it, we need to know what hyperparathyroidism is. Hyper refers to high amounts, and the parathyroid gland is actually a gland that secretes what's called parathyroid hormone, PTH. And we know that PTH raises serum calcium levels. Therefore, if we know that hyper means high, parathyroidism means PTH, which raises calcium levels, we will say A, it is elevated serum calcium. NCLEX question number two. We've got PAD, so peripheral artery disease, often causes claudication, which is characterized by which of the following? So we have to select all that apply. So we've got tissue hypoxia, we've got pain during rest, oxygen demand is greater than the supply, and it's relieved after rest. Okay, so first off, we need to know what peripheral artery disease is. And what it is basically a lack of blood flow through the arteries that's going to the tissues. So basically the cells that need a lot of nutrients and oxygen. So there's going to be some blockages and some barriers from getting that blood to the tissues, okay? Now, claudication. This is usually classified as pain during some form of exertion, okay, some cramping and that type of thing during exertion. Now, why is it during exertion? Well, when your tissues are exerting themselves, they need a lot of oxygen and nutrients, right? So if they can't get the blood that carries the oxygen and the nutrients, you're going to experience some pain, cramping, just general tiredness and weakness, okay? So knowing that, is it characterized by tissue hypoxia? The answer would be yes, it would be, because hypoxia literally refers to low oxygen levels in the blood. Now, specifically in tissues, basically the cells that need the oxygen, we're basically saying that tissues have low oxygen because the blood isn't carrying it to them. So the tissues are hypoxic. That is true. Pain during rest. This would not be correct. You wouldn't experience pain during rest because the cells themselves aren't being exerted. They're not using a lot of energy, so they don't need as much oxygen at that point. Therefore, you wouldn't be experiencing this type of hypoxia or pain during this time, okay? Next one, oxygen demand is greater than the supply of oxygen. Now, that would be true, and the reason for it is because as these cells are exerting themselves, they need more and more oxygen, but you can't provide it to them because you have PAD. So the blood and oxygen is not getting to the tissues. So that is true. And this would also be true that it's relieved after rest. Why? Because when you are resting, your cells don't need as much oxygen. So even though there's not enough oxygen getting there in the first place, the diminished need for oxygen makes it so that it's really not a problem. Wonderful. So that is claudication. NCLEX question number three. A nurse is administering IV furosemide, so intravenous furosemide, to a patient with congestive heart failure. Which outcome would we not expect, okay? So first off, two things stick out to me. Number one, we are giving them furosemide. You need to know furosemide as a loop diuretic. Okay, so this is going to actually go to the kidneys and it's going to inhibit the reabsorption of salt into the blood. If it's inhibiting the amount of salt in the blood, it's also going to inhibit water reabsorption, okay? So the biggest thing we will see with furosemide is this increased urine output, because instead of the fluid being put back into the blood, it's going to be inhibited, right? So that fluid has to go out somewhere. It's going to go out as urine. So we would expect this one. The second one, talking about decreased edema. So whenever a patient has congestive heart failure, one of the most common symptoms is going to be that edema, okay? And that is because the blood just gets backed up because the heart's not working properly. So some of that fluid that's leaking out of the capillaries can just stay in that interstitial fluid, okay? So by using a diuretic, okay, so we're getting rid of some of that fluid overload, we are actually going to decrease that edema. Some of that fluid will come out and be exported through the urine. So we will see decreased edema. The next one, decreased pain. Now, although we are going to be taking out some fluid for this patient, a lot of the times this doesn't actually help their pain, okay, associated with congestive heart failure. So this would likely be an outcome we would not expect. And the last one, decreased blood pressure. Since we're taking out some more fluid from the blood, we decrease blood volume, therefore decreasing blood pressure as well. So the answer would be C, decreased pain.